And then we just got to hit the Instagram go live button too.
Yeah. Now, every time I have to remember how to do this.
All right, here we go. Going live. YouTube's live.
Okay, here we go.
Instagram looks like it's live too. Perfect.
All right.
All right. Well, welcome everyone.
Hello.
Hello. We should do an introduction.
Yeah, Betty, give it a start.
I'm Betty. I'm a physician assistant. Been at Eviva a little over 3 years now. Do a little bit of weight loss surgery, a bit of medical weight loss as of late, and medication specifically. And I'm happy to be here. Thanks.
Yay. Thanks for joining us, Betty.
Wunderbar. Welcome. Thanks for joining. Thanks for being a wonderful member of the Eviva team.
Yes.
Dr. Tan.
All right. I'm Mimi Tan. I'm one of the bariatric surgeons here.
And I'm Dr. VanderWel. I am also one of the bariatric surgeons. So
yeah, yay.
Dr. Tan, what are we talking about today?
So today our topic is starting your weight loss journey 101. It is January. It is the new year. Everyone made New Year's resolutions. And I think weight loss is a very common one for a lot of folks. So for those who are trying to get their journey started or restarted or continued or getting back on track, I feel like this is a good topic for us to kind of start with here. So I think just very broadly, we can start with where would you start if you're hoping to lose some weight this year? What are kind of some things to think about? What are some things to plan for? Very broad.
Very broad. I think this is a great question for Betty.
Yes. Yes. Thank you. Yes. Like you said, new year, new me, right? It's just a nice reset after the crazy holiday season. It's always tough that time of year too. You are not alone. It's very common to struggle. And now we're in the new year, and it's nice to kind of look at where you want to be, where you're at. And so where should you start if you're hoping to lose some weight? I think it starts by just kind of knowing the options available to you. And so, there's obviously diet and exercise, which doesn't work for everyone by any means, but they both are very, very helpful in supporting weight loss and weight loss maintenance as well.
It's hard to lose weight if you don't level those ones up.
Exactly. Hard to lose weight and keep it off.
Yeah.
But there's medications for weight loss that have been around for a long time, and there's a few different medications. Obviously, you don't need to know the in and outs of every single one that's available, but just know that they are an option, and they're very common option. Like if you are at the point where you might need a medication, you're not alone, like I said, and it's not that you're doing anything wrong. It's that it just might be harder for you. What works for you is going to be different than what works for someone else. So,
and also know that like tens of millions of people are on medication now.
So many people.
Every like media movie award show now has like turned into a quasi joke advertisement for Ozempic.
Oh yeah.
There were more Ozempic jokes at the Golden Globes again last weekend.
No, and it's staying. It's not going anywhere anytime soon. So yeah, no, for sure. But medications, and obviously talking with a medical professional, you can talk through those specific options a little bit more. There's also surgery, which is, by and large, the best treatment and for weight loss, and the most sustainable in terms of, keeping weight off, a significant amount of weight off for a much longer period of time. And so just knowing those options are available to you, consulting with a professional and kind of saying, hey, where's my knowledge level? Where am I at? And, what do I need help with?
Yeah. So I think most folks have tried to lose weight on their own, right? They've tried different diets, and maybe they've lost weight, gained it back, or they haven't lost as much weight as they would like. At what point do you think it makes sense to kind of reach out to a healthcare provider?
Yeah, definitely. I mean, I say, if you're at the point where, so many people have this history of yo-yo dieting, right,
Yeah.
throughout their entire life, and it just sets you up, through your entire life. A lot of people get it from their moms or their family, right? Habits that you have, your environment growing up. And a lot of people, also they say, hey, when I was younger, I was able to keep things off. I was really active. And, as things change, you're doing the yo-yo dieting and you just find yourself being increasingly frustrated. You might lose some weight and then gain it back as soon as you stop it. And over years and years, like that gets so discouraging and it takes a huge toll on your mental health.
Right.
And
And your
so
metabolism.
exactly,
Mhm.
exactly. It makes it that much harder to lose weight when you get to the stronger quote unquote treatments. Um, but I honestly think earlier is better. If you have this
Yeah.
history, especially if you have a BMI of over 27, which puts you in the overweight category, or over 30, which puts you in the obese category and puts you at significant risk for obesity and health related issues. I think that at that point you should definitely look into some options.
Mhm.
But honestly, in terms of like for yourself, your self-confidence, your mental health, like earlier is better. These treatments, they don't have to be forever. I think
Yeah.
trying something out is something that a lot of people should be open to. So
Yeah.
Yeah.
I think one like misconception when it comes to getting medical help for weight loss is that you have to be a certain size. And that size based off of TV shows or whatever is that it's very large, right? Like my 600-pound life or, you know,
that's such
1,000-pound
a good
sisters. You have
example.
to be hundreds and hundreds of
Yeah.
pounds overweight before it makes sense to reach out to a doctor or a healthcare professional when it comes to weight loss. And that's not true. um,
100%.
so I think some of the things for folks is like if you feel like you are carrying around extra weight and if you feel like it's impacting your life negatively, and that might be a physical thing like your knees hurt, your joints hurt, your back hurts because of your weight, you don't sleep as well because of your weight, or you have an actual diagnosed disease like diabetes or high blood pressure that's maybe related to your weight as well, or even if it's like a mental health thing, if you feel like your mental health is suffering from a weight loss perspective or from a weight perspective, those are all very valid reasons to reach out and get help if you're struggling with losing weight on your own.
Yeah.
Um,
Exactly.
so,
Because obesity
30 to
rates are
300.
only increasing.
Yeah.
And
yeah,
a
yeah,
lot of people that could benefit, but you don't have to necessarily be quote unquote obese.
yeah,
And yeah, a lot of people have that misconception like, oh, I don't need surgery. I don't need medications. I'm not 600 pounds. Like,
yeah,
no, you don't have to be by any means. But so many people do struggle already with, like you said, joints hurting, can't breathe, can't do quote unquote normal things. If you can't fit
yeah,
into the airplane seat, like how does that feel? And how
yeah.
does that cost? And in the long run, how much is it going to cost you to be struggling with your weight at that point?
Yeah, yeah, or just like, people tell me all the time I can't keep up with my kids as I used to be able to, and things like that. That's
So
that's
Or
true.
still really
even as
important.
low as like, I've even offered, these tools to people that are 25, 35 pounds overweight sometimes,
Mhm.
particularly for like slight, like, women. If they're like normal weights around 105, 110 pounds, which is, not an insignificant amount of people that like that's where their frame should be. And they get up to like 135, 140, like most people would die for 140.
Yeah,
But there's like, I'm carrying like if you have a 100-pound frame and you're carrying around 30% of extra weight than you should be, like that's a lot. That's a pretty
yeah,
big
A lot.
delta on your body. So
yeah,
I think it's customized. And I think Betty, like you said, the yo-yo, if you start riding the yo-yo, if you start riding the roller coaster, like you just don't get on that ride again. Like take it up to the next level.
mm,
Let's go pro. And yeah, there's lots of great tools now. So
yeah, yeah. And I think the point though that Betty that you made of like knowing your tools when you do like the tools that are available and having some knowledge about what's available medically these days is really powerful when you go in and go talk to your PCP or whoever. Because unfortunately, there's still a lot of doctors out there who do just think diet and exercise is the right way to go when it comes to losing weight. So you do want to advocate for yourself and empower yourself and know that there are stronger tools available and that there are resources out there available when you start that discussion too.
A conversation I like to have, because I have like, family members of people of our patients, they'll be like, I just kind of need to lose weight. I'm not really sure what to do. And they're really like super wishy-washy and really uncertain about what they need to do. And they're and most of it, you can feel like they're like, I think I could do this myself. Maybe if I just like, maybe have a little bit more help. So I say, certainly talking with the nutritionist. But if you just go for like a 1,200 calorie diet for women, 1,600 diet calorie for men, and try to make sure you're getting at least 90 grams of protein a day, ideally up to 120 if you're a taller, like a bigger guy. And go with that and just give yourself 3 months, see how well you can stick to that. And if that's a massive struggle, or if you don't lose the weight that you can, because there's any number of different things, just reach out. Like, just set a number of like, hey, I want to hit this number by 3 months to 6 months. And if you're not at that number, you give us a call.
Yeah. And just to like set expectations too, I would say, like based off of the studies that we have looking at how much weight loss folks can achieve on average by themselves with just diet and exercise, we're probably looking at like a 3 to 5% range, which is going to be like, if you weigh 200 pounds right now, we're probably looking at 6 to 10 pounds that you're able to, take off and then actually keep off long term, which most folks who are hoping to lose weight, some people that's what they're hoping to lose, and that's great. But some folks, they do want to lose more than that. And if you do have medical problems that are related to your excess weight, you probably do actually need to lose more weight than that to actually move the needle at all from that standpoint. So if you're failing with diet and exercise on your own, it's actually not, I wouldn't call it failing, because you're just doing what most people actually do.
Yeah. I was just telling this to a patient right before this, which is your genetics do not think obesity exists. Your genetics is a myth. What's not a myth is hardship and scarcity. And that is what they are planning on. And that's what they're doing their strategic vision for. And they're building up their strategic reserve in your body, because winter's coming and the famine is coming and the rats are coming and you're going to die.
Winter is, and the rats are coming. Is that what you're
like, pestilence of like, getting your food supply. Imagine the feeling like back in the day, and you get into your little, your jar of rice or whatever beans that you have stored up, and like the rats have gotten through it and into it. Like, this is bad. Yeah.
Bad.
So I've been, I think I said this before, like I've been reading a lot of Age of Sail shit books from that time period. And like, so they have like all their food in these, in like these barrels, and they have like biscuits and apples, and they try to get some citrus and stuff for their vitamin C so they don't get scurvy, and they have like salted pork and stuff like that. And
lots of whiskey.
Yeah.
Or rum.
Lots of rum. Yeah. Rum was actually like rum, and they have this like diluted water beer that, because it keeps better. Like it doesn't go bad. And it has calories in it, which they need because they're working so hard. Yeah. But like all the time, like, either bugs would get into their food, or like rats would get into, because you can't get rid of rats on ships. Like you couldn't get rid of rats on the ships. And so they would like wipe out big swaths of their rations. And it was like a major problem. Yeah. I mean, that's just not what we, I mean, that's not a reality any of us have like had to work.
Yeah. I went and saw Gladiator 2 the other day. And my whole time I was just like, I would have done so poorly back in Roman times. I would have died very early.
Yeah.
That's
just hard. And that's a lot of people did die. Like, that's the thing. Like, that's what people don't understand too. Like, we think we can have everything, like we can have it all. If you don't have modern living is so wonderful and safe and has so many benefits. I spent a summer in Chad in medical school, and Chad has the second lowest life expectancy in the world. And people were just dying all the time. Like, you were just like, mothers would come in, died. Kids coming in, died. we had several of the workers that I worked with there, they died within the year that I was there. Like I heard, hey, so-and-so died, this person died, that person died. Like it was just crazy. Like death was just a part of like that was just a part of living. I mean, and you had a lot of kids because a good portion of them were going to die. And we've made a lot of progress in modern living, which is wonderful. But I think one of the side effects of modern living is it struggles. We're going to struggle with our weight. And that's what I saw in Chad too. Like there's no one struggles with their weight except for the people that are really rich. You can tell a really rich person because they were overweight.
Yeah. All right. Well,
on that happy note. So in the comments, thanks for people for joining in. If you have any questions that you want to ask, if you want to have any topics that you want us to discuss, throw them in the comment section and we will be happy to interject our sometimes tangential, sometimes moderately interesting discussions. So, cool. Well, Mimi, I think you have a couple more topics prepared.
Yeah. Well, okay. So say you're like, okay, I want to get some help for weight loss. I think one question just logistically is how do I figure out if my insurance will cover any of these things, whether that's medications or just even clinic visits to talk about weight or nutrition visits or surgery. And so I just wanted to cover that really quickly as well.
Yeah, I can hit that one. It's pretty easy. You go to avivamd.com. Probably with a mouse, I guess. Or actually, the data on our website is actually most people do it with their phone. 90% of our website traffic's on the phone. So you can just take your phone, go to avivamd.com. You put in your thing in there like, hey, just do a benefit check. And you just give your insurance information, a little bit of information about yourself. And we have people that are pros at that and they just check it. And then we let you know, hey, you have this, you don't have this, you may have that. And it looks like this and that. What do you want to do next? And so we try to make it really easy and straightforward. Insurance is really complicated. That's probably the most complicated thing about our job is that the insurance piece is just it's such a moving target. And as soon as you have it figured out, they change it on you. So we have people that like, literally all they do is, check insurance benefits because it's tricky. So, easy. So that's the easy one. Just like go to the Aviva MD website. It's going to be awesome.
Yeah. Yeah. Like you can certainly try doing it yourself, calling insurance companies, but it's definitely nice if you can have someone else do it for you.
Yeah. Yes. Not everybody has time to be on the phone with their insurance and get shuffled around and hear one thing from one person, another thing from someone else. It's nice to just kind of go straight to the source. If you are interested in, starting medication, surgery, or just want to hear your options, go to the source and let us help you out.
Betty, here's a great question. So a lot of people are interested in medication, but maybe their insurance, they find out, they do the benefit check, they find out their insurance doesn't cover like Ozempic or Mounjaro or Zepbound or whatever.
Which is happening more often than not.
Very frequently. Yeah. I mean, the insurance companies 2024 lost. I mean, they lost a ton of, they paid out a ton of money for these drugs last year.
Yep. Since the new year, it's been even rougher.
Yeah, they're tightening up a lot. So let's say someone can't get their insurance approval for the medications, but they're still really interested in trying it. What are their options?
Yeah. So, in terms of medications, first off, I should say surgery again is the most effective treatment for weight loss. If that's something you're like, not really considering, or maybe that's not for me, medications is your next kind of best bet. It is tough. A lot of medications, mostly really the GLP-1s, are going to be difficult to get covered by your insurance right now. Many of the other ones that we prescribe, like the oral medications, have been around a long time, and most insurance companies will cover them. And even the ones that don't, you can get a great cash pay price most often for like $10 a month at the pharmacy or either through goodrx.com. So in terms of oral medications, it's pretty affordable. In terms of injections, we actually work with local compounding pharmacies to do compounded formulations of the GLP-1s. And their pricing is they've cut their prices pretty significantly as time has gone on and popularity has increased. But they put out a really great product. I have probably more significantly more patients on compounded GLP-1s than on like the retail, like Mounjaro, Ozempic, Wegovy, etc. And exactly the same weight loss. Happy patients. No shortage issues with the compounding pharmacies, which is another big kind of barrier for your Ozempic and stuff at the retail pharmacy.
What sort of prices are we talking about?
Yeah, so very roughly, how the maths out is, depending on your dosing, different medication, it can be like week over week. I kind of like to give numbers like week over week. Per week, you can pay anything from like $20 to like $70 for the strongest and highest dose of the strongest medication. So it's pretty doable, better than $250 a week at the retail pharmacy, plus. And yeah, that's kind of where the pricing lies. Obviously, it varies because we start you off at a really low dose. We slowly increase your dose till you have good weight loss, good appetite control. But everyone's dose is a little bit different. So,
what do you see with people that have had surgery before that have a smaller stomach? What sort of dosing do they generally need with the GLP-1s?
Yes. So a couple things. So the first is that they generally have a much faster response and need a lot less of the medication to kind of start seeing results. And then secondly is they just see more results. Honestly, they lose more weight. They seem to keep it off better, because they're already have surgery on board, which helps significantly. And, they're already doing a lot of the lifestyle things for the most part. So, healthy diet, high protein, staying active, doing small portions, that kind of thing. So people who have had surgery do significantly better with the GLP-1.
I was actually looking at a little bit of my data on that like this week, and I was like, wow, my no surgery people, it's tough to kind of get them up to speed sometimes. It's tough to, it's interesting. Yeah, it's interesting. So
weight loss takes time too. And, it takes time to find a medication that works for you, to make sure that you tolerate that medication, to see the results that you want. And so that's just another thing to take into consideration is it takes time. And, there's so many options available. And for a lot of people, they've been trying so hard for so long that, give it a little more time, be a little more patient and be open to things, I should say.
So surgery and medication together, they seem to decrease appetite, increase satiety, and to some extent now the GLP-1s increase some restriction. Why is it that there's such a difference in the weight loss that's experienced? Because I mean, like real world, data is somewhere between 8 to 15% for semaglutide, 15 to 20% for tirzepatide, or versus like laparoscopic sleeve, endoscopic sleeve averages for us in our practice around 24%, laparoscopic sleeves around 30%. And bypass even a couple percentages above that. Why is there such a difference, you guys think?
Between surgery and medications? Is that
because if both of them are reducing appetite significantly, because I think a thing we hear a lot with both of our medication and our surgery patients is like just a lot less hungry, just not really that hungry anymore. And I get satisfied and I'm cool with a lot less food. And I would say maybe the sticking point for me, which is what I think the biggest difference when I ask patients, is like the amount of food that they can eat at a time. And this is where I think when I was looking at some of my data on and some of the stories of some of the people that have normal stomachs that are doing medical weight loss, the portion size that they're able to do, not necessarily that they have to do, but that they're able to do, seem to be, are just way bigger than what you can do just by the nature of a smaller stomach, with an endo sleeve, a lap sleeve, a gastric bypass. So, but it's amazing how much that matters. It seems like.
I think at the end of the day, like we honestly don't know how our surgeries work, right? I think it's a little bit of a black box, unfortunately, but I think a huge part of it is it's just purely mechanical. Like your stomach is less than a quarter of the size that it used to be with the sleeve. It's the size of an egg after your gastric bypass, and then the bypass has its own mechanisms too.
Yeah.
And, there's also hormonal changes that happen with both of the surgeries. So it ends up just being an overall really powerful tool. And, I wish we could fully explain, if we knew all the things, I think, that went into why people are so successful after surgery.
Yeah, with surgery, we try
I'm
to.
sure the pharmaceutical companies would
be all over that.
But I think a lot of it is just the physical change, right?
Yeah. I have a question from Mary in my Instagram chat. Thanks for submitting a question, Mary. Are we seeing more gastroparesis? This is something I worry about long term. So excellent question, Mary. Thank you. Particularly gastroparesis surgery-wise, not really a thing we see. Actually, surgery, laparoscopic sleeve, and bypasses are good treatments for gastroparesis. Gastroparesis with the GLP-1s is a very real thing. That is one of the mechanisms of the way it works, is that it slows down the pumping of the stomach. So the peristalsis and the breakdown action, it actually has a pan slowdown of the GI tract in general for most patients. I don't know about you guys. I haven't seen any of my patients with anything that I got one guy that I'm like, hey dude, I think he's just over his portion sizes are too large, and he's having the normal side of, the featured gastroparesis of the drug, it seems like, but he's just kind of overeating his portion sizes. So he's way too full, and he's having some side effects from that. But when I talk to the GI, when I go to the hospital and I run into the GI guys and we get talking, because they're all like, oh, GLP-1s, because all the bad GI issues like the pancreatitis and the pan dysmotilities, like when the GI's tract slows down, the gastroparesis, they'll end up with the GI guys. And I mean, when millions of people are on these drugs, and there's some level of side effect of that, and the bad ones get dumped, they see the bad ones there. I have not seen a GI doctor. I don't know, you guys, I'm sure they're out there, but I haven't seen a lot of GI doctors that I've met at the hospital that are very positive about GLP-1s. Yeah.
Interesting. Because I do think,
guys' thoughts?
I think we probably end up not seeing a lot of that to some degree too, just because if you're not tolerating it, you probably kind of drop out and stop seeing us.
You may just stop showing up,
and just you end up going to see your GI instead. I think there's a lot to be learned about gastroparesis with these medications. These medications are all relatively new. We know that that's a concern, but I feel like we don't know enough about how often it's happening yet. We don't really have papers that are telling that as much. And usually I tell folks, yes, we should be mindful that there could be side effects with these medications long term that we don't know about or don't know very much about. But we know that excess weight is causing you bad things right now. And so that's something that we need to address right now. But yeah, certainly something to keep our ears perked up about.
Yeah. I mean, look at Fen from years ago. It had this huge hype. So many of our current patients have tried it before, and a few years down the line, there were some issues with it. So, always approaching any type of new treatment with reasonable amount of caution and doing your due diligence. But
yeah, my mom does primary care, and she says she's actually stopped a number of her GLP-1 patients because she's pretty concerned about the gastroparesis portion. They're getting the symptoms, the pain, the constant feeling of dyspepsia, just discomfort in their stomach area. I will say anecdotally, I think that because the drug just decreases the breakdown action of the food and the emptying of the stomach, you really, really have to be mindful of your portion sizes with this medication.
Yes.
And I think I like to think of it in a similar mechanism to actually heart failure. So when you have, for a lot of congestive heart failure, what happens is that your heart stops pumping as well. And then it's not pumping as well. It's not getting your kidneys well perfused and getting them enough pressure to actually, get fluid off your body. And then it makes it worse. And then you get more fluid. And as those muscle fibers get further apart, their contractions ability gets weaker and worse and worse. So one of the main therapies for congestive heart failure is to make sure that you're not holding on to excess water, and so that your heart, the ventricles of your heart, have enough space in there so that the muscles are optimally contracting. And that's where I think, like with the stomach, trying to really prevent that over distension of the stomach, because those muscles are just really not working they need a little bit of help to get everything going like they want to. So especially when you're first starting the drug, being mindful of the types of foods that you're eating. If you're eating food that takes a lot of work to break down, like red meats and raw vegetables, like those, your stomach has to work pretty hard to break those things down to the molecular level, or at least down to the, close to molecular level. So then you can have the chemical digestion. But you want to, if you keep those portion sizes, you'll give your stomach the best opportunity, number one, for less calories, number two, to let the stomach actually function well, and to work with what it's got. So do I have any data on that? Nope, no data, but it's that's my theory. And I do find that if people keep their portion sizes, they have a lot less issues. There's less pain, there's less nausea. So
and I think in all of this, what I wanted to just bring up was, partly one, the compounding pharmacy, thing that we brought up. And then just Brandon, you had brought up how like some patients who start these medications, they do kind of struggle a little bit more initially to kind of get that weight loss going. I'll just say that, compounding pharmacies, there are concerns that folks have about compounding pharmacies. You'll hear about them. I would be very cautious of going on the internets alone and seeking out compounded medication yourself. I think you should be going through a trusted clinic that specializes in weight loss, and that's probably the safest, best route to go about getting these medications.
A lot of it.
Yeah, because there's just it's a little bit of a scary world out there. Quality is not the same everywhere that you go, and then in the same way, these medications, in my mind, there's a way, like you can just take them. There's plenty of clinics that will just prescribe you these medications, but you're not going to be using the medication in an optimal way if they're not also teaching you how to change your lifestyle, change your diet in a way that's also conducive to like optimizing your use of these medications. And so a lot of people are on these medications, but I would say there's probably a very small percentage of folks, unfortunately, who are actually using this medication as they should be. And so that's an important thing to keep in mind if you're interested in getting started.
Definitely. Yeah, I get that question all the time where it's like, oh, well, do I need to be on this medication forever? Which brings up a great point. It's like, no, you don't need to be on it forever, but what is going to maintain that weight loss after you've gone off the medication is those healthy lifestyles that the medication gives you that space to really build, right? Because if you're struggling all day, all the time with hunger, with cravings, if you just need a lot more food than other people to get full, there's all sorts of ways that you could be struggling. These medications help to reduce all those things, right? So you have that space, so you can say, okay, I can actually follow these smaller portion sizes. I can eat more things that are more conducive to my health, rather than reaching for sugar or other types of things that people snack on and such. And building those lifestyles and seeing the results is just, I think it just does something physically and mentally. Even though the medication's well out of your system months out, if you've stopped the medication, like if you're continuing these habits, like, yeah, some appetite might return. But I think like you just see a switch. And it's how committed you are too, while you're on the medication, that also dictates, how well do you do after. So.
Yeah. I like to think, I tell my patients too, like, the window, the therapeutic, the best long-term sustainable window for this medication is that we're not pushing it so hard that you're miserable and you're like averse to food. And so you're losing weight because you can't even stand the thought of food. And there are people that get that. And I think some of the trials actually pushed people that far, which is why, in the clinical trials, you don't see real life has not demonstrated any clinical trial, the benefit of the clinical trial like we've seen for these medications. And then there's the other part, which is just like, it just barely takes away some of that food noise and that appetite. And yeah, like you said, Betty, like getting that space to like be intentional about your food choices and your portion sizes, and building some habits and some routines and some time in that space is what's really going to help you be able to be successful with this long term. But because if you're going so far the other side where you're like, I don't even want to think about food, as soon as you stop the drug and your hunger comes back, like, what do you have? You have nothing. You just have a lot of hunger and a lot less lean body mass because you've been losing, weight in an unhealthy way, and you have no habits to lean on afterwards. So.
Yeah. And I would say the muscle mass piece is probably the biggest thing I worry about too with these injections. Like, there is a way to lose weight that is not healthy with these injections. And a big part of that is you lose muscle, and then you're actually worse off because it's so hard to gain back muscle afterwards. And so, again, really important to have someone who can kind of work with you and has experience with the medications to kind of make sure you're doing it in a way that's safe.
Yeah, definitely. I think, I think also like avoiding that all or nothing mindset is something that is really good because, you don't want to necessarily lose as much weight as possible as quickly as possible, right? Because then that means you can gain it back that much faster, or, you're not losing it in a healthy way, like you said. And I think like just in general, right? Like the all or nothing mindset, that's kind of the same mindset that you get when you go all in with like a fad diet, right? Or you're all in. Some people, New Year, they're like, I'm going to go to the gym 5 times a week, even though I've never gone to the gym before ever. And then they're doing great for a couple weeks. And then they're like, okay, I'm back to my normal stuff. I'm tired of
sustainable.
Tired of eating that way. I'm tired. Exactly. And I think like just long term, like it's those small incremental changes and staying consistent over time. And that's something that so many people like just have not done ever. And it's not a bad thing. It's just a lot of people, it takes a lot of consistency and those small changes constantly, and being positive and moving forward and bouncing back when, hey, the holidays come up and you've eaten a little bit more and you've gained a little weight, just not beating yourself up over it, but saying, hey, what can I do like from today moving forward? What can I do to treat myself better, really?
Yeah.
Really quickly, do we want to touch on so we've talked a lot about medications. When should you be thinking more along the lines of surgery rather than medications? Like who should be thinking that?
I think anyone with a BMI over 40 should seriously consider surgery first. Yeah. The chance of you getting to where you want to get to when your BMI is 40 is low. It's not good. Like if you're not there in the headspace, then do the best thing, do the thing that you're the most. If your BMI is above 40, seriously consider surgery. But ultimately, you need to be the most aggressive that you can because it's hard. It's hard.
Yeah. I would say, I think all these tools have their pros and cons, right? And at the end of the day, it's worth having a discussion with someone about what are the pros and cons of surgery? What are the pros and cons of medications? Where can I potentially get with surgery versus medications? And how does that correlate with my ultimate goals in terms of health and lifestyle and whatnot? Generally speaking, surgery is going to be it's more durable. It's going to give you more weight loss. And so those are the major benefits that come with surgery. And it's not a medication that you have to necessarily take long term. And so for a lot of patients, I think this is again where it's nice to meet with someone who has good knowledge about both and can kind of direct you in the right direction, right? Because it's and it's good to also, when you start meeting with folks, to like talk about your weight goals, to know what your goals are as well. Like, where do you want to get to? What are you hoping to achieve, so that we can kind of help figure out what tool is best for you. Because sometimes it will be surgery, sometimes it will be more medications. And so it's a personal decision at the end of the day.
Hey, quick question.
But I agree that if you have a lot of weight to lose, surgery's going to be.
I mean, if you're above BMI 40, you should like audit. Like the first thing you should think is surgery. Or if you have diabetes. If you have diabetes, honestly,
yes,
Quick interruption. Gary on Instagram asks, what does surgery do to your immune system long term? Great question, Gary. Dr. Tan, do you want to take this one off?
Your immune system.
Yeah.
Long term. That's a good question. I'm trying to think about how that would change your immune system. I don't know if I know of like a ton of data about immune function and weight, but I would think, excess weight it increases stress hormones in your body. It's a stressful environment for your body to live in, and it's going to probably tank your immune system. After surgery, or after some of these medications, we do want to be mindful of vitamin deficiencies potentially that can also influence your immune system, but we're pretty usually aggressive.
The chances of vitamin deficiencies in a modern bariatric surgery is so low now. Yeah. Like a pervasive. I think it's a really good question. It's a really good question. Yeah. That's what a lot of people have. And I think the underlying question too is, what are the health side effects of having weight loss surgery? And from the immune system standpoint, I think just like you said, being obese is an inflammatory state, which is bad for your and less immunosuppressive for your system. And when people, and also interestingly, obesity, that inflammatory state also makes autoimmune diseases more common. Generally, we very rarely see an exacerbation of any sort of autoimmune diseases after surgery. It's possible that there's still some disease progression for some diseases. I wish I could say this was a magic bullet for everything, but it's very rarely that we haven't seen any correlated with any sort of worsening disease pattern of cancers, of autoimmune diseases, of those sort of things. It's actually been beneficial for all those things. I'd say like you said, Mimi, the one thing that we worry about long-term is vitamin deficiencies for, malabsorptive procedures like a gastric bypass, if you're not taking your vitamins. And then sometimes heartburn can sometimes be a little bit worsened after a laparoscopic sleeve. But for the most part, there's stuff that comes up in life in general, which is why the entire field of medicine. But it's generally very, very helpful to be lighter. Very, very helpful on your body.
Go ahead.
Oh, I think in all of medical school, I can remember one disease entity where having extra weight maybe helps improve symptoms a little bit. And I think it's either Crohn's or UC. I can't remember which one it was, but it was the only thing that I remember. And everyone was like, this is a weird thing, but this is true. And
is it the same one that also smoking helps? I thought there
maybe.
Was yeah. Okay, that's funny.
It's like the anti-disease. Yeah. That's funny.
But it's not a lot.
Actually, in motor vehicle accidents, people that are heavier, at least from the initial injury, have less injury than people that are lighter. Yeah.
Wait, what?
There's a little bit of data that people that are really heavy, like if you're carrying an excess of 100 plus pounds, versus someone that doesn't have that weight, the initial injury seems to you get less injured.
Oh, okay.
The problem with it is that when you are injured, you have a lot higher complication rates because everything's harder to manage. So
that's probably true.
Yeah, but it is the one sort of protective thing, because I think it's just it's a physics equation of you have more mass and you also have a little bit more protection. So you're protecting some more of your organs and systems and stuff like that. But the problem is that when you do get injured and you're obese, it makes every medical condition is harder. Every medical procedure is harder. Everything that you do has more complication rates if you're obese. That's actually one of the reasons I became a bariatric surgeon, is because there's so many times when you're doing surgery and the patient's obese and they have complications and it's so hard to manage, and everyone's so frustrated with their obesity. Patients frustrated with their obesity. They don't like it. And we're just like, well, this person sucks. I wish they would just eat shit and die. That's kind of the feeling that a lot of doctors have about obesity. And you're just like, hey, there's actually good treatments for this. Why don't we do that?
There's actually a surgery that we can do.
Yeah. So.
All right. Well, I think we're rounding out the hour here. Do we
Yeah.
have time for more, or do we want to just kind of pause here?
Yeah.
Might be a good
Yeah,
place
Gary
to-
said, yeah, padding. LOL. Indeed. Yeah. About the one time it's an advantage to have that extra padding is the initial injury. But if you do get injured, it really works against you. So
All right. Well, Betty, thanks for joining us this week.
yeah. Thank you
So
everybody for
fun.
tuning in, and Betty for being here. Dr. Tance, always a pleasure. So
Yeah, always.
Awesome.
is
Thank you
is this the
guys.
last Instagram before the time?
What was that?
Is this our last Instagram visit with you or meeting with you until?
No, we actually have another one. I think in 2 weeks.
Okay.
Yeah.
That'll be the end.
So,
And then
yeah.
baby time.
Yeah, I'll be gone.
That'll be the beginning.
And then it's not the same.
Yeah.
TUAP says I'm having heart palpitations. Gotta get checked out, man. Gotta get checked out, or ma'am. Not sure. No. All right. Thanks everybody for joining, and tune in next time. 2 weeks. And yeah, if you have any questions, feel free to submit questions to us on our website, and go from there.
All right.
Awesome. Thank you guys.
Bye.
Have a great day, everybody.
Bye.